So I really appreciate this comment, and there is a ton here to unpack, more than I could ever do in a video. So I'm going to just touch on two parts. First, I think that you're partially correct, that there is a bias currently against mental health related to the current mistrust of medical treatment, and that mistrust of medical treatment is a huge conversation that we could have probably for many months here. And I would just suggest that I think we have maybe swung on that pendulum a little too far from previously treating doctors as gods to, oh, they don't know anything because I can look it up on Google, as opposed to something in between. And there's a number of issues with the whole medical model of viewing everything that is out of alignment with sort of the mean, with expected averages, as being a disorder that needs to be fixed, as opposed to simply acknowledged and honored. And that spills into mental health. The other part, though, that I think is not touched on in your comment is that there has been a long-standing historical bias against mental health treatment, even when doctors were viewed with reverence, more than they may have deserved. Because mental health and all the things we associate with it, depression and anxiety and so on, have been lumped into a moral judgment of you are weak, and if you were stronger and better, you wouldn't have feelings of anxiety or sadness and so on. So I think the two of those layer together to create much more of a bias against mental health care than there is against healthcare right now. Because I think people will seek out physical health care well before they seek out mental health care still, although it is getting better. Appreciate the comment. Again, happy to talk on this subject more, but this is a lot when it comes to feelings about medical treatment these days. As always, if you like this kind of content and want more, please follow, like, and comment like this for ideas for future videos.